Hello, my name is Deirdre Nocton and I'm the Director of Midwifery in Portiuncula University Hospital. Congratulations on your pregnancy, and we are delighted you have chosen to have your baby here with us. The short videos that follow are designed to give you additional information that will assist and enrich you during your pregnancy and postnatal journey.
Hypnobirthing birth preparation classes are currently one-day virtual workshop via Zoom. They provide you with the knowledge, confidence and tools for birth. The best time to attend this course is between 24 and 32 weeks of pregnancy. The aim of hypnobirthing is to take all the negative associations around birth and turn them into positive associations. It aims to take the fear out of childbirth. We will cover all about hormones, affirmations, visualizations, birth preferences. We'll do some breathing, massage and relaxation methods on this course. You can book this course through maternity website or ask your midwife for more information. We look forward to meeting you and your birth partner on the course.
supported care pathway is the pathway whereby healthy, well women with uncomplicated pregnancies can access midwifery-led care for their pregnancy, birth and postnatal period. Midwifery-led care has shown to increase a mother's chance of having a normal vaginal birth, reducing caesarean section rates, less preterm birth, episiotomies, epidurals, greater breastfeeding success, and a more positive pregnancy and birth experience when compared to any other model of care. In Portiuncula Hospital, the midwifery-led antenatal clinics, as part of the supported care pathway, now provide care to about 50% of the mothers and their families attending this hospital. Once you've seen your consultant and there is no reason that excludes you from attending midwifery-led clinics, an appointment will be sent to you to meet a midwife at 20 weeks. Care will continue from there as an opt-out service shared with your GP for the rest of your pregnancy once all remains well. These appointments are here in Portiuncula, Athlone and Loughrea, 5 days a week, ideally at a time that suits you for as long as you need, focusing on your concerns, support, education and preparation for birth and life with your baby. We aim for you to meet 2 midwives at the most through your pregnancy. This will improve your experience of the service. Your midwife can arrange extra blood tests, scans and referrals as needed, in addition to the ultrasounds and bloods offered as standard. We will support you in any way we can during your pregnancy, and our team wish you a safe and positive birth and joy with your new baby.
Hi, I'm Olivia Summers, lactation specialist in Portiuncula University Hospital. Breastfeeding is the optimum source of nutrition for newborn infants. It is liquid gold, providing both nutrition and immunity. Breastfeeding is the natural way to feed a baby, but that is not to say that it is always easy. It is a learned skill obtained through observation and experience, and it requires practice and patience to master it in the early days. The benefits for babies includes that it provides them with stronger immune systems, it reduces their risk for infections, it lowers the risk of asthma and diabetes, it reduces the risk of obesity, and it lowers the risk of sudden infant death syndrome. For mums, it lowers the risk for cancers such as breast cancer and ovarian cancer, and it reduces the risk for postnatal depression. One of the best ways to prepare for your breastfeeding journey is to attend the Antenatal Preparing to Breastfeed workshop. Preparation is key. Knowing what to expect and what the norms are is key to trusting your breastfeeding in the early days. You can book your class on our website or ask your midwife for more information.
Hi, I'm Claire, the mental health midwife here in Portiuncula Hospital. Our aim is to put mental health in pregnancy on a par with physical health and recognise the importance of looking after women's health before and after baby is born. Difficulties with mental health in pregnancy can affect not just the mom but also the baby and the whole family. And up until quite recently, many people thought that women didn't really get depressed or anxious in pregnancy, that it was more of a postnatal thing. However, now we know that antenatal anxiety and depression can cause lots of issues for women before the baby is born and can continue on after. So it's important to look after your own mental health while you're pregnant. It could be something as simple as getting out for a walk, keeping in contact with friends and family, even a chat on the phone can help. Some women need a bit of extra help and support with their mental health during their pregnancy. And this is not surprising as women go through so many changes. It's not at all easy. Also, women who have a past history of mental health problems are more at risk than others of developing an issue in pregnancy. These women need to be extra mindful of their mental health, as prevention is often better than cure. And it's important to mention any concerns you have at GP visits or maternity department visits. And I just want women to be well and happy enough to enjoy their pregnancy and the early newborn phase, which can pass in a flash. So look after yourself, and I hope to see you again at the antenatal class where I talk more about your mental health.
Here in the Special Care Baby Unit, also known as SCABU, we care for babies from 32 weeks gestation and above. They may be with us for a few hours or a few weeks, depending on their needs. We are an 8-bedded unit with 1 ICU space. There are many reasons why your baby may come to SCABU. We aim to ensure that you and your baby receive excellent round-the-clock care from our specialised team, where family-centred care is at the core of our philosophy. You will be encouraged and supported to fully participate in all aspects of your baby's care.
Hi everybody, Patricia here, the diabetic nurse from maternity, with a little video about glucose tolerance tests or GTTs. This is a test we do in pregnancy to diagnose gestational diabetes. There are a variety of reasons or risk factors that your midwife will identify at your booking appointment, such as you've had gestational diabetes before, you've had a previous big baby, polycystic ovary syndrome, you have a high BMI, or fertility treatment. Usually the glucose tolerance test is done at 24 to 28 weeks gestation. However, some women may come early at 18 weeks and may need the test repeated later in pregnancy. Also, some women may be referred if we find sugar or glucose in your urine. The test requires you to fast for 12 hours before your first blood test. So fasting from 10 p.m. the night before, as the test usually starts at 10 a.m. You may drink sips of water only. You must not smoke, chew gum, or take things like Gaviscon. The test takes 2 to 3 hours in total. You come into hospital and the midwives take a sample of blood. This is a fasting sample of blood that tells us the level of sugar in your blood when you are fasting. You will then be given a sugary drink to drink over half an hour. It is really sugary and can be a little difficult to drink on an empty tummy, so please do your best. After that, you're asked to take a seat in the waiting room. It's important that you do not rush around during the glucose tolerance test, as this may impact the overall results. You come back 1 hour after the sugary drink and your blood test is repeated. This lets us know how your body has responded when we give you this sugary drink. You are then asked to take a seat in the waiting room for a second time, and after another hour you come back for a third blood test. This allows us to see if your body has produced enough insulin. If your readings indicate you have gestational diabetes, the midwife will call you with your results. You are then booked into the gestational clinic and you're seen by myself and Professor Liu, the diabetes doctor.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now.
Hello, Nuala here, Parent Education Midwife. I am going to discuss both natural and pharmacological pain relief options for labour and birth. Water or hydrotherapy is a fantastic way to ease pain and cope with surges during birth. During your labour, having warm showers and baths can help you to relax and cope with pain. The support of a partner and one-to-one support from a midwife has been shown to reduce a woman's need for pain relief in labour and increase her chances of a natural birth. Comfort measures, mobilisation and birth aids such as beanbags, birthing balls, hot or cold compresses aid discomfort during birth. Use of labour hopscotch can help you cope during your labour and give you a higher chance of a natural birth. Hypnobirthing is a birth preparation course that teaches you to access your subconscious mind, to relax, trust your body and alleviate the fear of childbirth. Techniques such as visualization and meditation can relieve pain. Relaxation is a skill which takes practice. Work on cognitive measures should be done throughout your third trimester. A TENS machine or transcutaneous electrical nerve stimulation is a non-pharmacological method for relieving pain. TENS machine targets nerve pathways to boost natural endorphins in the body to cope with pain. The earlier in labour the TENS machine is applied, the more effective it is. You should be familiar with your TENS machine prior to your birth. You can hire or buy a TENS machine from your local pharmacy or budget retail chain. Pharmacological methods. Paracetamol is safe in pregnancy and can be taken to ease pain, particularly in early labour. Ensure only to take the recommended amount. Pethidine is an opioid pain medication given via intramuscular injection. It works within 20 minutes and relief lasts up to 4 hours. It will not get rid of labour pain completely, but will help you cope better and allow you to rest. It is routinely given with an anti-nausea injection. Pethidine crosses the placental barrier, so cannot be used in the latter stages of labour. Entonox, also known as gas and air, is a mixture of oxygen and nitrous oxide gas. It is inhaled via a mouthpiece. Entonox won't get rid of the pain completely, but it is a good distraction and can help to regulate your breathing. Entonox is readily available in the labour ward. An epidural is a type of local anaesthetic given into the epidural space in the back. An epidural numbs the nerves that carry the pain impulses from the birth canal to the brain. Prior to getting an epidural, an IV cannula will be placed in your arm to administer fluids to regulate your blood pressure. An anaesthetist is the only person that can administer an epidural. You need to sit in a slouched position for approximately 20 minutes to get the epidural inserted. The anaesthetist will insert a needle into your back and pass a tube or catheter into your back that will continuously administer anaesthetic to you until after your baby is born. An epidural is the most effective form of pain relief for labour and birth. However, you will be restricted to the bed throughout your labour. Continuous fetal monitoring is recommended with an epidural. A urinary catheter will be inserted into your bladder, as with an epidural you lose the sensation to pass urine. An epidural is associated with a higher incidence of assisted birth. A spinal anaesthetic is a technique in which local anaesthetic is placed directly in the back. It numbs you from above your bump, and it is primarily used in maternity for elective cesarean sections. You can use any and all of these pain relief methods throughout your labour and birth. You do not need to know exactly what type of pain relief you would like for your birth. Your midwife will guide you on the day and answer any questions you have.
Hello, my name is Natalia and I am going to discuss and explain what fetal monitoring is, why and how we do it. During your pregnancy, labour and birth, Various assessments are carried out to ensure everything is progressing normally and your baby is not experiencing any difficulties. One such assessment is listening to the baby's heartbeat. Most babies go through pregnancy, labour and birth and are born without any problems. However, there are some babies who have difficulties, and the best way of finding out when a baby is experiencing difficulties is to listen to their heartbeat. You will be offered to have your baby's heartbeat monitored, known as fetal monitoring, during your pregnancy, labour and birth. Fetal monitoring can be done in two ways. Intermittent auscultation, listening for a short time at regular intervals with a Doppler or Pinard stethoscope. Continuous electronic fetal monitoring, EFM, known as continuous monitoring, using a cardiotocograph, CTG machine that draws a graph of your baby's heart rate and your surges or contractions. Intermittent auscultation is monitoring your baby's heartbeat by using a Pinard stethoscope or handheld Doppler. During your birth, the midwife will palpate your abdomen to feel for a contraction. They will listen to your baby's heartbeat for a full minute at the end of a surge or contraction. I'm going to just listen to your baby's heartbeat for a minute with the Pinard. Is that okay? As labour progresses, your baby's heartbeat will be checked more often. In the first stage of labour, your baby's heartbeat will be monitored every 15 minutes and every 5 minutes in the second stage of labour. Your pulse will also be monitored at the same time to differentiate between your heart rate and your baby's heart rate. A cardiotocograph, CTG, carries out continuous fetal monitoring or electronic fetal monitoring. It produces a visual display and in some cases a paper recording of both the baby's heartbeat, the mother's heartbeat and any uterine activity. Two discs called transducers are placed on the abdomen with some gel. These are held in place with two elastic belts.
Belts around here.
One disc picks up the baby's heartbeat and the other disc picks up the frequency of the mother's uterine activity.
Sounds like a happy baby. So this is the monitor to measure any uterine activity. So we put it here at the top of the uterus, okay?
The machine produces a continuous graph of both of these referred to as the trace. The machine also produces a beating or pulsing sound that represents your baby's heartbeat. Your blood pressure, heart rate, temperature and oxygen levels will be all checked regularly throughout your pregnancy and birth.
So I'll get you to put your finger in there. Now, and both numbers come up here, Vanessa. Just do this under your arm. Put your arm up.
You may also be given a clicker to push every time you feel your baby move.
36-ish. That's perfect. Melissa, this is a little monitor to measure your baby's movements. So every time you feel your baby move, can you click the top button there?
Mobile CTG monitors are available to enable you to mobilise and change position while being monitored. If you're admitted to hospital with any issues after 26 weeks of pregnancy, a daily CTG will be recommended. If your pregnancy or birth is considered high risk for any reason, a CTG will be the recommended method of fetal monitoring during your baby's birth. A list of common reasons where continuous fetal monitoring is recommended can be found in your fetal monitoring leaflet. Your healthcare practitioner will discuss the recommended method of fetal monitoring with you. They will answer any questions you have, and your consent will be sought prior to carrying out any fetal monitoring.
Hello, my name is Dr. Julie Higgins. I'm a midwife who works for the Celta Hospital Group, and today I'm going to talk to you about using a birthing ball in pregnancy and labour. If you have any questions, you can talk to your midwife or physiotherapist. It is very important to choose the right size ball for yourself and to make sure that it is safe to use. All of the Celta Group maternity hospitals recommend you buy a birthing ball that is compliant with the European Device Quality Directive. Information on companies that acknowledge their compliance and to learn more about finding the right size ball for yourself are available in our online information leaflet, The Use of the Birthing Ball in Pregnancy and Labour. First things first. To sit on the ball safely, you steady the base with your hands as you sit down. Put your feet firmly on the ground, shoulder width apart, with your hips about 10 centimetres above your knees. Being active and staying upright for as long as possible during labour has many benefits for you and your baby. Using a birthing ball during your pregnancy aids relaxation, may help to strengthen your abdominal and lower back muscles, eases back pain, and allows you to practice positions for labour and birth. Positions to use on the birthing ball can be bouncing up and down, circling, doing figure of 8, and kneeling. When you practice these positions during your pregnancy, you become very familiar with them and you're more comfortable moving into these positions during labour. A very common position women adopt in labour is the kneeling position. This position encourages physical and mental relaxation. Lying forward on a birthing ball can help to ease the pressure in your back, which most women experience at some point during labour. It is also a very natural position to birth your baby. To get into the kneeling position, first kneel, seated on your heels, with your legs slightly apart, arms and hands resting on the ball with your head turned to one side. Raise yourself up on your knees, lean over the birthing ball and try rocking side to side or front to back. You can place a pillow under your knees for extra comfort. I've just mentioned a few positions that you can use with the birthing ball here. You will receive more information about other positions to use with your ball from your midwife or physiotherapist at your antenatal class.